Today being Monday, we'll report on 3 reporting periods. From January 15th to 16th, we had 584 new cases diagnosed with COVID-19 in British Columbia. From the 16th through the 17th, an additional 445 new cases. And in the last 24 hours, an additional 301 people were diagnosed with COVID-19. That brings us to 1,330 new cases, 4 of whom were epidemiologically linked cases. So our total in British Columbia is 61,447 people who've been diagnosed with COVID-19. Of the new cases, 281 were people in the Vancouver Coastal Health Region, 548 were in the Fraser Health Region, 65 people were in the Vancouver Island Health Region, 257 people in the Interior Health Region, 166 people in the Northern Health Region, and 13 cases were people who normally reside outside of Canada, and the majority of those 13 cases were some of our new temporary farm workers who've come into BC for the coming season. And as you know, we are continuing our program of providing quarantine accommodations in hotels and support for people, the temporary farm workers who are coming into BC to work on farms in the very important role that they play supporting our agriculture industry here in the province. So we now have 4,326 active cases across British Columbia, of whom 343 are in hospital, 68 of whom are in critical care or ICU. Additionally, we have 6,865 people under active public health monitoring. Again, that continues to exclude the monitoring they're doing in the north. And 54,656 people have recovered in that they're no longer positive for COVID-19. Over the last 3 days, we've had an additional 31 people in British Columbia who've died from COVID-19, bringing the total number to 1,078 people who've died. The vast majority of those are seniors and elders in long-term care. And to the families, the care providers, and our communities who've lost our seniors and our loved ones, our thoughts and condolences are with you again today. We have 1 new healthcare outbreak to report over the last reporting period at the Eagle Ridge Manor, and outbreaks are now over at Aged Care Harmony Court, Laurel Place, Capilano Care Centre, and McKinney Place in Interior Health. And we are very thankful that McKinney Place has been under control. That was a very challenging outbreak in Interior Health, and we know 17 people in the McKinney Place community lost their lives to COVID in that outbreak. That leaves us with 48 active outbreaks in long-term care and assisted living and 10 acute care units, involving 2,054 people in long-term care, 1,339 residents, and 708 staff. So we do want to bring you up to date today on some of the immunization activities that have been going on for the last few days. And I don't know if we have a slide available yet, but I will provide the data, and we will have both a slide available, but also it will be posted on the BC CDC dashboard as of this afternoon. So since the start of our immunization program in December, we have provided 87,346 people with COVID-19 vaccine in BC. And over the past week, we've received 46,675 doses of vaccine, 28,275 of the Pfizer vaccine, and 18,400 doses of Moderna. The Moderna vaccine, I will note, though, that 18,400 doses all came on Friday, and a good proportion of it was distributed around the province, and over the weekend, doses were delivered. So this week, We are expecting another 26,775 doses of Pfizer vaccine, in total, including 24,375 doses of the Pfizer vaccine and 2,400, the final installment of the doses we were meant to receive last week of Moderna vaccine. So where that leaves us right now is of the 87,346 doses that we have given, 71,301 have been of the Pfizer vaccine out of the 78,975 doses we've received, and we've provided 16,045 doses of Moderna of the 38,900 doses we received, just recognizing that the 18,000 and some of those doses of Moderna just arrived on the weekend. And since Friday, we've delivered 9,695 doses, 6,679 of the Pfizer vaccine, and 3,016 doses of Moderna vaccine. So, as you can see, the program continues. Our focus continues to be on immunizing all people who are at the greatest risk, and that includes residents and staff who work in long-term care homes around the province, as well as the key roles that we have in our acute care facilities. As you know, as was announced last week, Canada has received notice that there will be delays in the Pfizer vaccine supply for this week, but more specifically for next week and the subsequent 2 weeks. Although the supply comes back up again very quickly, next week is where we'll be most affected. We received those numbers over the weekend, and we know that this delay will temporarily slow our delivery into the next phase of at-risk people, particularly into other parts of our hospital system. However, the process we knew was going to be changing and changing frequently, and we know that these challenges with such a large program that's going to be going on for many weeks. We have, however, been able to rearrange and look at the process that we have to make sure that we are continuing with providing the first of 2 doses to those at highest risk, and that we are able to start second doses at day 35 in accordance to our plans that we announced a few weeks ago. So that is our focus over the next couple of weeks. It is a bit of a setback, but it is only a delay. We are expecting to receive and have been reassured that we will receive the extra doses at the end of February and early March to be able to continue to expand our first dose program and to ensure that those at highest risk in our high-risk categories are covered as soon as possible. What that will mean, though, is that the focus will be on second doses starting next week and the week after, and then we'll building back up again to be able to provide additional first doses to those at risk. And as I mentioned, the dashboard will be published this afternoon on the BC CDC website. And we do have to remember that even though our COVID-19 immunization program is underway and continues and will continue in the coming weeks and months, the risks remain high all over British Columbia, and we see that from the numbers over the weekend. This is why we need to continue to take those measures that we know work to stop the spread. It's to keep everybody who has not yet been vaccinated as safe as possible in this period of time of hope and challenge as we move towards being able to provide immunization to everybody. It's also why we continue to have our public health orders and restrictions in place. I do want to pause, though, because the science has shown us, and it shows us now in what we are seeing across the world as people are being immunized, that these vaccines are very effective. And from somebody who's been working in the vaccine world for 30 years, it is amazing to us that we can have in such a short period of time a new technology that is 95% effective in protecting somebody from a new disease, and even more effective at preventing people from having severe illness and dying from COVID-19. This is amazing to all of us, and it's what we need to focus on to keep us going through this period of time until more vaccine comes and we can protect more of our community. Right now, it's our individual efforts that will have the biggest impact, and we can't yet rely on vaccine to protect all of us. In the next few months, though, we will have more and more people protected. And although today we have a slight delay, we are still on track to protect those most vulnerable by the end of March, and starting in April to expand dramatically the access to vaccine to people across the province to protect us all. For now, stopping transmission in our communities keeps our long-term care homes safe. Stopping transmission in our communities keeps our schools and our workplaces going and safe. The biggest risk and the biggest variance we have right now is all of us, our human behavior, the choices that we make every day. So no matter what variant of the virus is circulating in our communities, we know we need to stop the spread in the same way that we have been doing for the last 11 months. We have the tools, and it is in our control. That means keeping our safe distance when we're with others, particularly in indoor public places. No social gatherings, even small gatherings we have seen, can spread this virus to the people we are closest to, and that is what we want to avoid at this period of time. Wearing masks when we're in indoor public places, covering our cough, cleaning our hands regularly, and staying home if we're not feeling well. And of course, getting tested if we have any concerns at all. Let's show each other that we remain committed to doing our part to protect our seniors and elders who've not yet had the vaccine, even as we have more of this protective vaccine in our communities. But we need to protect our neighbors, our families, our loved ones, and do this to support all of our essential workers who are there for us every day. Across our province, today and tomorrow and for the next few weeks, everything we do will make a difference. And as always, we do this in the spirit of kindness and staying calm and being supportive of each other and staying safe. Thank you.